Aneurysms of arteries can happen in any part of the body. As you know, the artery runs from heart to leg. This can balloon and expand due to disease process, but commonly, the aorta, which is close to the heart and comes from to the abdomen, what is called a thoracic aorta or the abdominal aorta, is very, very common. The risk factors are usually age, smoking, and high blood pressure, especially uncontrolled blood pressure. So that is why this disease is very, very common in the Western countries, where the elderly population is very high. However, in our country also, as the elderly population is growing up, the disease is also becoming commoner and commoner. So if you are an elderly person and a hypertensive patient, history of smoking, I think, especially with the heart disease, go for the aortic screening program very early. The symptoms may not have anything because until it reaches a critical size. So patients usually comes as an emergency, and at that time, the treatment options become very, very restricted. So if you have all the risk factors, you should go for screening program. However, the treatment options are available in late stages also. We normally do aortogram or an angiogram to confirm the size of the aorta, and depending on the size of the aneurysm, we have a treatment plan. These days, we have excellent endovascular treatment programs in the form of thoracic endovascular aneurysm repair, which is called a TEVAR, or for abdominal aortic aneurysm, endovascular aortic aneurysm repair, what is called a EVAR. And even for complex aortic aneurysms, we have excellent procedures, what is called hybrid procedures, and fenestrated grafts available, so that the risks and complications are very, very minimized. Older days, we have only option of open surgery, which had very high mortality and morbidity. These days, our centers do endovascular procedures with very minimal mortality and morbidity, less than 1% or so. So, if you have risk factors and symptoms, you should see our specialist immediately so that we can treat you early for our best results.